Welcome back and welcome to Chapter 4, States of Consciousness. Have you ever had the thought, what is consciousness? Well, consciousness is the awareness of your internal and external stimuli around you. So things like feeling hungry, feeling pain, detecting light, maybe when you're sleeping. Wakefulness is the high levels of awareness of your senses, so any of your senses, any of your thoughts, and your behavior. Your biological rhythm is the internal cycle of biological activity, like your body temperature fluctuating throughout the night, throughout the day, also a woman's menstrual cycle, and also the levels of alertness throughout the day and night. Your circadian rhythm is your internal biological clock. It occurs over approximately 24 hours. It's generated by the suprachiasmatic nucleus. The sleep-wake cycle, one of our main circadian rhythms, is linked to our environment's natural light-dark cycle. So the idea is at night you tend to get more sleepy, in the morning you tend to be more awake. The hypothalamus is responsible for maintaining homeostasis, which is our tendency to maintain a balance within our body, an optimal level within our biological system. Here's a visual of our circadian rhythm's influence on body temperature throughout the night. And here's a visual of the suprachiasmatic nucleus that I referred to earlier. It's located in the hypothalamus and it serves as our brain's clock. The clock sets itself with light information received through projections from our retina, and it allows us to synchronize with the outside world. Our sleep-wake cycle is also regulated by other factors, such as our hormone melatonin. Most people think melatonin is a pill that we take to help us sleep, but it actually is a hormone that we release naturally in our body. It's stimulated by darkness, it makes us sleepy, and it's inhibited by daylight. So it's not as effective during the day. And it's released by the pineal gland. Sleep regulation is the brain's control of switching between sleep and wake, as well as coordinating with the outside world. Each person has their own internal clock or circadian rhythm. Things that disrupt sleep are jet lag and rotating shift work, for example. So jet lag, if you went to Europe, your time difference is going to be quite extensive and you're going to notice more jet lag. That's why it's encouraged to get on the time of wherever you're visiting. So even though you get there and maybe normally you would be going to sleep, stay awake and go to bed at 10 o'clock in the time of the place that you're at. Because jet lag can cause fatigue, sluggishness, irritability, and the inability to sleep, insomnia. Rotating shift work is similar. So if you're rotating from mornings to afternoons to nights, every couple months, you're going to have similar side effects. You're going to be irritable, you're going to be exhausted, you might have problems remembering, and you'll have also a hard time sleeping when you really need to be sleeping. One option to help with this is bright light. It can realign the biological clock with the external environment, and there's a visual there of a device that helps with the bright light. Sleep deprivation. Sleep debt is when you're not getting enough sleep on an extensive basis and it becomes a chronic problem. Sleep rebound is when it takes you a much less time to fall asleep because you've been deprived of sleep for so long. Some side effects, some negative consequences of having sleep deprivation are cognitively, you might be irritable, you will have impairment, memory loss, your moral judgment could be impaired, you'd have severe yawning, you could have hallucinations, and you might also have similar symptoms to ADHD, hyperactivity. Sleep deprivation also impairs your immune system. It makes you be at a higher risk of having diabetes type 2. It can increase your heart rate, which will make you higher risk of heart disease. It can increase your reaction time, but your accuracy is decreased. You could have tremors and aches. You could also have suppression of growth, so it keeps you from growing. You could be at risk of obesity, and you may have decreased temperature. So different sleep needs at different ages. Here's a chart from 0 to 3 months to over 65. What is sleep? It's a state marked by relatively low physical activity and a reduced sense of awareness. Sleep wake cycles seem to be controlled by multiple brain areas, including the thalamus and hypothalamus and the pons, which is where REM stage sleep occurs. Sleep is associated with the secretion and regulation of many hormones. We already talked about melatonin. It also includes follicle stimulating hormone, luteinizing hormone, and growth hormone. Here's a visual of the brain areas that are involved in sleep. So the hypothalamus, the suprachiasmatic nucleus that we talked about earlier, the pituitary gland, the pons, the pineal gland, and the thalamus. So all the pineal and the pituitary glands secrete a number of hormones during sleep. Why do we sleep? Adaptive function is the evolutionary hypothesis of why we sleep. It believes that sleep is essential to restore resources that we expend during the day, and sleep is an adaptive response to predatory risks, which increase darkness. So saying that predators are more likely at night, so you go to sleep and you're away from the world. There's not a lot of evidence to support these explanations. The cognitive function theory focuses on sleep's importance for cognitive function and memory formation. Research shows that sleep deprivation results in disruption in cognition and causes memory deficits. These impairments become more severe as the amount of sleep deprivation increases. Slow wave sleep appears to be essential for effective memory formation. So you probably can think of a time where maybe you had a lot of assignments and exams and things all within a few days, and so you weren't getting the proper amount of sleep, and you start noticing that your memory isn't good, or you're forgetting things that you normally would never forget. You forget where you put your keys, or you forget somebody's name or something that you normally would have no problem with. And that's from deprivation of sleep. And it shows you how important sleep is. Benefits of sleep: it helps you to maintain a healthy weight. It lowers stress levels, improves mood, increases motor coordination, and then also includes many benefits related to cognition and memory, as we just talked about. Your brain waves during sleep. The activity changes dramatically across the different stages of sleep throughout the night. You can see this using an EEG. Alpha, theta, delta frequencies. Alpha is relatively low, relatively high amplitude. Theta is low frequency, low amplitude, and delta is low frequency, high amplitude. And there's a visual for you of the different types of waves. So now we're going to talk about the stages of sleep. Stage 1 is a transitional phase where you're between wake and sleep. Your respiration and heartbeat slow down. Your muscle tension and core body temperature decrease. And this is where you're in alpha waves. So that's what you would see on an EEG during stage 1. Stage 2, the body goes into a deep relaxation. And this is where you'll see theta waves. And it's characterized by the appearance of both sleep spindles and K complexes. The sleep spindle is that rapid burst of high frequency brain wave. So it almost looks like you're awake. K complexes are very high amplitude pattern of brain activity. Stage 3 and 4 are known as slow wave sleep, and this is where you'll see delta waves. And your respiration and heart rate slow down further in stage 3 and 4. REM sleep, REM stands for rapid eye movement. This is where you're in a paralysis of voluntary muscles. This is also where you dream. So many times you'll think you're dreaming when you're close to having just fallen asleep, or you wake up in the middle of the night. It depends on what stage of sleep you're at to signify whether it was really a dream. Because dreams, true dreams, only happen during REM sleep. During this stage, brainwaves are very similar to those of being awake. And you'll see in this figure here, in figure A, a period of REM is marked by the short red line segment. It looks very similar to brainwaves that are seen during B here that are actually when you're awake. Here's a visual of a hypnogram of sleep stages. A hypnogram is a diagram of the stages of sleep as they occur during a period of sleep. This particular one illustrates an individual moving through the various stages of sleep. Moving on to dreams. So there are a lot of theories on why we dream and what they mean across cultures and across history. Freud saw dreams as a way to gain access to the unconscious. Manifest content would be the actual content of the dream, and then the latent would be, he would say, the hidden meaning of the dream. Jung believed that dreams allowed us to tap into our collective unconscious, which is a theoretical repository of information shared by all people across the cultures. It's believed that certain symbols in dream reflected universal archetypes. So Carl Jung's theory on dreams is very interesting, especially learning how different symbols correlate to different ideas. Research has shown that dreams may represent life events that are important to the dreamer. Dreaming may represent a state of proto-consciousness or a virtual reality in the mind that helps a person during consciousness. Lucid dreams are certain aspects of wakefulness are maintained during a dreaming state. A person becomes aware that they're dreaming. So in lucid dreams, you're not actually asleep. Insomnia is a sleep disorder that is unfortunately experienced by many. It's defined by having a hard time falling asleep or staying asleep for at least 3 nights a week for at least 1 month's time. It is the most common sleep disorder, and at times it could be associated with depression. Because some contributing factors include age, drug use, exercise, mental status, and bedtime routines. Treatment for insomnia includes stress management techniques, changes in problematic behaviors that might be contributing to the insomnia, and then cognitive behavioral therapy, which focuses on cognitive processes or thought processes and any problem behaviors that are keeping you from sleeping. I've suffered from insomnia off and on my entire life, and many times it has to do with the stress in your life, but there's definitely things that you might be doing that you don't even realize that are not helping you to have a better sleep routine. Parasomnia involves unwanted motor behavior and experiences throughout the sleep cycle. So it could be sleepwalking, REM sleep behavior disorder, restless leg syndrome, and or night terrors. Sleepwalking usually occurs during slow wave sleep. Many times sleepwalking or sleep talking happens more when you're younger, and many outgrow it, but not always. REM sleep behavior disorder occurs when the muscle paralysis associated with the REM sleep does not occur. It includes high levels of physical activity during REM sleep. It's often treated with an anti-anxiety medication. So what happens is you're in REM sleep, you're usually basically paralyzed. Even if you woke up, you would feel like, why can't I move my arms or legs? In REM sleep behavior disorder, that's not happening. So your muscles are very active. You might be hitting, you might be pushing, you might, just be moving around. Restless leg syndrome is uncomfortable sensation in the legs, that keep you from being able to fall asleep. It can be treated with a variety of medications as well. Night terrors are sleeper experiences a sense of panic and may scream or attempt to escape. And this occurs during the non-REM sleep. Sleep apnea has become a very common disorder. I know numerous people, including my husband, that have sleep apnea and are now using a CPAP, which is the visuals here. This occurs when individuals stop breathing during their sleep. It usually lasts for 10 to 20 seconds. It can be longer though. My husband's much longer. It includes repeated disruptions in sleep that lead to increased levels of fatigue because they're not getting enough oxygen to their brain. It is common in people that are overweight, but I think that's kind of an old school way of thought because all the people that I know that have sleep apnea are not overweight. There are two types of sleep apnea, obstructive and central. Obstructive, the airway becomes blocked and air is prevented from entering the lungs. And then central, the CNS fails to initiate breathing. And as I said, there's two visuals of a CPAP. SIDS is very similar to sleep apnea, but it occurs in infants. And an infant stops breathing during sleep and can die. It usually occurs in infants younger than 12 months, and boys have a greater chance than girls. Their lungs develop later than girls, which could contribute. Premature birth would contribute to what I was just talking about with boys. Smoking within the home, and also hyperthermia. And it's recommended to put babies to sleep on their back, which can help in SIDS not occurring. Narcolepsy involves an irresistible urge to fall asleep during waking hours. It's often triggered by states of heightened arousal or stress. It shares many features of REM sleep, including cataplexy, so loss of muscle control while awake, or in some cases, complete paralysis of your muscles. You can't move your muscles voluntarily. Hypnagogic hallucinations, so vivid dream-like hallucinations. It's important to understand with narcolepsy that it can happen anywhere, so it's non-discriminatory. You could be driving, you could be in the act of making love, you could be climbing into a burning building, and it can occur during any of these times, which, as I said earlier, can be triggered by heightened arousal or stress, which any of those situations would fall into that category. Treatment is usually psychomotor stimulant drugs. Another state of consciousness is substance use disorders. It's a compulsive pattern of drug use despite negative consequences as defined in the DSM-5. It involves physical and psychological dependence. Physiological involves changes in normal bodily functions and withdrawal upon stopping use. Psychological dependence is the emotional need for the drug. Tolerance occurs when a person requires more and more of a drug to achieve effects previously experienced at lower doses. So they're always going after that first high. It's linked to physiological dependence. Withdrawal is the negative symptoms that one experiences when drug use is stopped. And the withdrawal can vary from drug to drug. Some are much harder than others. Here's a visual of drug categories. So antipsychotics, stimulants, depressants, and hallucinogens. And then the drugs that go into all 4 of those categories. Here's a list of the drug categories and their effects. I won't go through all of them. But again, the class of drug would be stimulants, depressants, opiates, and hallucinogens. And then it'll give you examples. It'll give you the effects on the body and effects when used. It also tells you whether they're psychologically addicting, which all 4 of those categories are. Depressants are drugs that suppress the central nervous system, usually GABA agonists, which have a quieting effect on the brain. They work by binding to GABA receptors, which makes the neuron less likely to fire. Depressants include alcohol, barbiturates, and benzodiazepines. Also includes, alcohol. Let's talk specifically about. It decreases reaction time and visual acuity. It lowers levels of alertness. It reduces behavioral control and can result in complete loss of consciousness. The GABA-gated chloride channel is embedded in the cell membrane of certain neurons. The channel has multiple receptor sites where alcohol, barbiturates, and benzodiazepines bind to exert their effects. And you can see this visual over here on the side that shows that neuron and the GABA receptor sites. This opens the chloride channel, allowing negatively charged chloride ions into the neuron cell body. Changing its charge in a negative direction pushes the neuron away from firing, which activates the GABA neuron, and it gives a quieting effect on the brain. Stimulants increase overall levels of neural activity, usually dopamine agonists, which work by preventing the reuptake of dopamine. Dopamine activity is associated with reward and craving, so these drugs can be highly addictive. It includes cocaine, amphetamine, cathinones or bath salts, and MDMA. Side effects include nausea, high blood pressure, high heart rate, feelings of anxiety, hallucinations, and paranoia. And you'll see here a visual of crack rocks. And here's the visual of a dopamine agonist. As many of their mechanisms of action, cocaine and amphetamine, block the reuptake of dopamine from the synapse into the presynaptic cell. This results in a large amount of dopamine in the synapse, which causes it to continue to respond. Nicotine and caffeine. So continuing on substances, caffeine and nicotine are also stimulants. Caffeine involves antagonizing adenosine activity. It increases levels of alertness and arousal. Nicotine interacts with our acetylcholine receptors. It can be highly addictive, and it plays a role in arousal and reward mechanisms. Opioids serve as analgesics, which decrease pain through their effects on the endogenous opioid neurotransmitter system. Opioids are highly addictive. The concern more recently with opioids is that they're prescribed, so that's been for many years now, for different pain as a result of different surgeries, and then the patient gets addicted to them and can't get off of them, and it really can wreak havoc with your whole life. Other things that are opioids are heroin, morphine, methadone, and codeine, which the morphine, methadone, and codeine are in many medications that are actually prescribed. Here's a visual of some different types of opioids. Hallucinogens cause changes in sensory and perceptual experiences. They can involve vivid hallucinations. They vary with regards to the specific neurotransmitter system that they affect. So mescaline and LSD affect the serotonin agonist. PCP and ketamine affect the NMDA glutamate receptor antagonist. And here are some visuals of psychedelic images and medical marijuana. Another state of consciousness is hypnosis. Here's a visual of a popular portrayal of hypnosis that led to some misconceptions in history. Hypnosis is an extreme focus on the self. It involves suggested changes of behavior or experience. The clinician may use relaxation and suggestion in an attempt to alter the thoughts and perceptions of a patient. For example, maybe to increase memory, maybe to stop smoking, maybe to bring up painful memories from childhood. So it has had some success in different areas, and then other areas it's not going to be helpful with. Some of the areas that have found success are pain management, treatment of depression and anxiety, stopping smoking, like I said, and weight loss. Meditation is another state of consciousness. It's the act of focusing on a single target, such as your breath or a repeated sound, and it increases the awareness and helps you stay in the moment. It involves relaxed yet focused awareness. It shows promise in stress management, sleep quality, pain management, and treatment of mood and anxiety disorders. Here are two visuals, a meditating Buddha and somebody practicing meditation. And that concludes chapter 4, States of Consciousness, and I look forward to seeing you next time.